Our next speaker is Georgina Loughnan. Georgina is a physiotherapist whom we've known at IPSO for many years, who's attached to the Metabolism and Obesity Services Division of the Royal Prince Alfred Hospital in Sydney. Her main interest is in weight management for people with intellectual disabilities and in mental illness. She established the first PWS clinic in Australia for weight and lifestyle management. Georgina has presented at many conferences and topics, and she's also co-written 3 books and many research papers on PWS. Georgina is presently on the board of IPSO and is coordinating FamCare program. Today, Georgina will discuss family care and physical therapy for people with Prader syndrome. Thank you, Georgina.
Thank you very much. I'd just first of all like to thank Don and Marguerite for inviting me to come, and as Suzanne and Hubert have alluded to, we've had a wonderful time so far, and it's a great honour to be presenting at your conference. I'm going to speak to you first of all about physical activity for people with PWS, and I'm assuming I just start. Okay, good. All right, lovely. I'll move through it fairly quickly, but please feel free to ask me questions afterwards. So, just looking at the facts, you know a lot about PWS, so I'm just going to summarise the main facts that are important when it comes to why is exercise such a major part of lifestyle for people with PWS. Now, in my clinic, I mainly see adolescents and adults, but we'll cover children as well. So the fact number 1 is that people with PWS have lower muscle tone and muscle bulk. That muscle tone basically means resistance to movement, so it's decreased. They have decreased muscle strength, looser muscles, so more elongated muscles, so they have less stable joints. They have a lower total daily energy expenditure, but when you calculate for muscle, it's in the normal range. It's only low because they have the low muscle. Because they have less muscle, they have a less fat-burning potential. Basically, we burn fat at the site of our muscles, so the more muscle we have, the more fat-burning potential we have, the less we have likewise. They develop poor posture as a result of low muscle tone and eventually osteoporosis as well. All this leads them then to have a lowered cardiorespiratory capacity, a decreased capacity for physical work because they have less strong muscles, and they're less motivated to exercise. And on top of all this, we're saying they need a caloric restriction, which in turn decreases their muscle, which impounds the whole situation. Secondly, they have a greater percentage of fat, and we know that the body composition is altered in people with PWS. They have a greater percentage of fat storage cells, so they can store more fat, they gain fat readily, and we know that once you lose weight, your body's always trying to get back to that fat point. They have an increased cardiac risk because they have more fat, which again turns around and says they need less calories. If we give them too many calories without exercise, we're going to also reduce their muscle. And as Suzanne mentioned, many people with PWS have sleep apnea, so this doesn't particularly encourage them to exercise. They have a hypothalamic hunger, so they have increased hunger, decreased satiety, so they're generally focused on food more than anything else in their lives, as we saw in the videos. They have a reduced maturation, meaning they are at greater risk of osteoporosis because they have lower levels of gonadotropins or sex hormones. They desire sameness. Now, this is the positive point. They dislike new interventions, however, they like consistency. And starting exercise with someone with PWS is always difficult, but once it's put in place and it's consistently adhered to, you obviously have increased compliance, so much so that some of my clients want to exercise too much and we have to pull back. The basics of obesity. Now, exercise does a hell of a lot more for you than just manage obesity, but let's just have a little look. Nature makes no provision for digesting more than her proper wants demand, okay? Very old quote, and it's still exactly the same today. So whether we have PWS or not, if we ingest more calories than our body's using, we store them as fat. In obesity, the genes load the gun, but the environment pulls the trigger. And in Prader-Willi syndrome, yes, they're set up, but we manage their environment, and we can make their environment highly suitable so that obesity does not develop. Okay, so what is the relevance of exercise for PWS? I've alluded to most of it. Weight management, yes, is always number one. Cardiovascular fitness is extremely important. Respiratory fitness. They have often decreased inspiration because of decreased tone in the intercostal muscles. And if they're obese on top of that, it's heavy lifting your chest, so even just breathing deeply is sometimes limited. Muscle strength's most important to alter body composition, to try and improve body composition, to improve general skill training, which comes with stronger muscles, more stable joints, and of course to increase mood. Okay, so let's go through what exercise can do. We know that exercise burns energy. On the right, we have a sedentary person who doesn't move very much. Our total daily energy expenditure is broken up into three main areas: resting metabolic rate, the thermic effect of food, and the thermic effect of exercise. The only category that we can actually manage is the thermic effect of exercise. So we can increase how much energy is used up through exercise or physical activity, but we don't have a great impact on the others personally. So if we look at the sedentary person who spends 75% of their energy expenditure through resting metabolic rate, but then we look at the physically active person who only spends 60% through the resting metabolic rate, but 32% through the thermic effect of exercise by exercising. So the exercise category can be occur anywhere in the range from 10% to 40% of our daily energy expenditure. But how do we make that change? How do we improve that? By being physically active. Okay. We know that exercise increases metabolic rate. It doesn't just increase metabolic rate while you're exercising. You do get a post-exercise effect, and we've got to think of this with the guys with PWS as well. Most of what I'm talking to you has been clinically known in research for the general population. Not all of it has been proven scientifically in the PWS world. So if ever you get the opportunity to enrol your children or clients in scientific research involving exercise, jump at it, because we need a lot more scientific-based evidence. So, pre-exercise metabolic rate is quite low. When you start to exercise, your metabolic rate increases. Your metabolic rate is the rate at which we burn energy, okay? So you get a raised metabolic rate during exercise, but when exercise stopped, your rate does not immediately return to the pre-exercise lower level. It gradually comes down, and depending on the intensity and the duration of the exercise you've done, you can prolong this EPOC, or excess post-oxygen consumption, basically how much energy you're burning once you've stopped exercising. You can prolong that by the intensity and the duration of the exercise that's done. Okay, so you're getting a double whammy. You're burning more calories when you're exercising, and you retain a higher level of energy burn up in the rest period after exercising as it gradually comes back to the resting level. And yes, exercise ideally should be in the weight loss range or the aerobic range. We want to improve the health of heart and lungs, so anywhere between roughly 60 to 75 to 80% of predicted maximum heart rate. Now this is not, you don't have to actually measure all this in your people with PWS, but it's just something to know. To exercise efficiently, they need to be working, not just strolling. Second, exercise also maintains our diet effect. As I said, we know that we have in people with PWS, there's a much greater percentage of fat. When we ask people to diet, if any of us here have ever been on a diet, we lose weight very nicely in the first few weeks. But if we're not exercising, that rate of weight loss will slow right down, because we're starting to lose muscle as well as fat, and muscle is our point of energy burn-up. So when you're including exercise in a weight loss management program, you can burn almost 3 times as much fat because you're retaining muscle, and this is essential in people with PWS, whether they've been on growth hormone or not. We know that exercise or physical activity builds muscle, and it's mainly resisted exercise that does. And you can see on the left, beautiful, strong deltoid bicep muscles. On the right, he doesn't do a great deal of exercise. They're slightly longer, narrow. Exercise will not only increase the number of muscle fibres, but it will increase the size of the muscle fibres. And this also, we feel, is occurring in people with PWS. Studies by Elsholzer has proven that exercise certainly increases muscle bulk in people with PWS. We know that exercise improves insulin sensitivity. Now, most people with PWS who are not overweight or obese have normal, if not slightly lower, insulin levels. However, once obesity develops, or overweight, then obesity, they're at a great risk of developing diabetes, which gives them increased insulin levels, or hyperinsulinemia. The major treatment for hyperinsulinemia, or the first treatment, is exercise, because exercise makes your body more sensitive to the use of insulin, so the uptake of insulin is increased. Extremely important for people with PWS who have hyperinsulinemia as a result of overweight or even diabetes. Exercise improves circulation. Why is it so important? Because we actually have quite a few clients who are not necessarily overly obese, but they do have high blood pressure. And exercise is actually the #1 treatment for high blood pressure, although most people who go to the doctor are given medication for blood pressure. But if you have high blood pressure, exercise is the way to get it down. More importantly, with the increased blood flow, we can increase the flow of blood to the brain by 30% through exercise, which will improve concentration. Okay. Exercise also works at improving edema, or fat in the lower part of the limbs. Now, this person has a lot of fat in her legs. Now, most of what you see here is fatty tissue. There is a small degree of lymphedema, but most of it is fatty tissue. So exercise is extremely important to burn fat throughout the body, including the legs. However, we also see edema that can develop from chronic venous insufficiency. And exercise, actually, the calf muscles work as a pump to improve the flow of blood and reduce edema. So you're using exercise for two different reasons here, for the fat in the legs, but also for the edema and perhaps lymphedema if it is there as well. And exercise is really the main treatment for lymphedema. Wrapping legs is fine, but on people with PWS who have that shaped leg, the bandages always just flop down, but exercise is the best thing you can encourage them to do. Exercise improves bone density, and we know in people with PWS, because of the reduced androgens, they're at great risk of osteoporosis. I also see a lot of osteoporosis in children or adolescents who've been extremely well managed with their weight by food restriction, but not exercise. The impact of exercise on bone is essential to protect bone, especially in the young years. Okay. We know exercise increases well-being due to the increase in endorphin release to improve mood, relaxation, reduce anxiety, reduce anger. And if any of your people with PWS are exercising regularly, you will have noticed a change in their behaviour. We see this time and time again, and I think it's probably got a bit to do with the endorphin release. Okay, and studies tell us that yes, exercise certainly has a great result on depression or tension or stress in both men and women. The types of exercise I'm talking about are aerobic type for improved heart and lung fitness and burning fat, and also toning exercises which are resisted exercises using weights, preferably not the weights you buy in the shop from the sports stores. I tend to use plastic bottles with water in them because they don't cause as much damage if they're thrown. Okay, where to start? In childhood. Physical activity or exercise is generally done to improve the achievement of motor milestones, to improve muscle tone, strength, joint protection. And it would start with occupational therapy, with physiotherapy, and also just family activities, being as active as possible. The guys I see with PWS who are in really good shape, and most of mine have not been on growth hormone, have all had very active families, and they've been active from a very young age, and this is where it has to start. Swimming, it's fun, it's low impact, it's easy for people with PWS. Facilitated play, kicking balls around, weight-bearing exercise is essential. Peter Davies from Queensland University has produced this book. It's on our IPSPO website. You can download it. There are a limited number of copies at the front, but it's excellent for equating physical activity to food intake and energy intake. Okay, so that's basically what it looks like. So, as part of life in adulthood, exercise is vital for weight management, for bone strength, for the prevention of comorbidities or the treating of comorbidities such as high blood pressure or diabetes, for general fitness, and of course for mood. Where do you start? You start small. Obviously, it has to fit the person. Everybody's individual, and you start what suits that individual. It may be just 10 minutes a day, but the aim is to improve incidental activity, chores around the house. Remember, people with PWS aren't sick, they just have Prader-Willi syndrome. They're quite capable of being involved in family life with chores like everyone else except taking out the garbage. Exercise prescription is vital. Setting it up so that it becomes a program and it's part of their life, 30 to 60 minutes, and it needs to be supervised, otherwise they'll put their feet on the sides of the treadmill if that's what they're using. Can be walking, but it needs to be so that it's working them. For the exercise to be effective, they need to feel, well, you need to see that they are getting hot, slightly shorter of breath, and it's actually working them. As I said, it's not just a stroll in the park. Having equipment in the home is a great way of getting the exercise into their life on a regular basis. It also makes life much easier. You don't have to go out and spend time getting there and actually getting out the door to start with, but it's all there for them, and it becomes part of their daily routine. As I said, they need to feel hot, puffed and sweaty, but not exhausted. Sorry, that's moved up a bit, everything's moved. Okay, remembering warming up and cooling down is just as important for people with PWS as it is for the non-PWS population, to prevent soft tissue injuries and to prevent sudden changes in blood pressure. Strengthening exercise, as I said, are great for building muscle strength and protecting our joints, as well as incidental activities or activities of daily life. Posture, simple things, just reminding them to put their head up, keeping their shoulders back, putting their arms at elbow length when they're eating so that they're sitting up straight in the chair. Simple things that you would remind your other children. So the benefits of fitness in PWS are decreased fat, ease of movement, improved mood and self-esteem, enhancing their opportunity for employment and day program attendance, reducing their comorbidities, and a healthy longevity. This is just a study looking at 2 groups of 12 people in our clinic. Those who had exercise equipment in the home ended up in the regular exercise category, and those who didn't. And just over a 12-month period, those who had regular effective exercise, and as we saw, most of them had equipment in the home, ended up losing 9 kilos, whereas the others actually gained 2 kilos. To show you that it really does work, both of these clients live in separate homes. They're not PWS-specific homes, but that both homes have treadmills. They have 2 treadmills, one for the staff member, one for the client, and both these guys have lost, David's lost over, well, nearly 80 kilos, and Scotty's lost 66 kilos. And they've never been on growth hormone. Another young man, he lives in a PWS-specific home who is in the healthy weight range BMI-wise, and he maintains a lovely weight now at the lower end of the healthy weight range. And just to show you that it really is important that it's 6 days a week. I say 6 days a week. A lot of people say 7, but I think they need 1 day off. This is just the program of one of our clients. Now, he was on growth hormone for about 8 years, but he lives at home with his family, who are very devoted. He runs along Bondi Beach 2 days a week when he's with his dad, but he does all this other equipment. So it's quite a full program for him, but this is what's keeping him fit. Okay, so just remember that exercise is the vital link to good health and fitness, in PWS in particularly. Okay, thank you. Now I'll just get out of this. You're welcome. It's not there. Sorry? The FamCare? Yeah. Sorry, it's not there. No. I'm now just going to speak to you about, on your program it says family care, and it's actually about FamCare, which is a group that we established through IPSWO. It's a small committee who is looking, thank you very much, who is working on supporting parents of adults with PWS who still live in the family home. So we have, we have a committee of Kate, Fanny, Sabine, Damien, myself, Rika, Leslie and Linda. And We come from the USA, Chile, Australia, South Africa and New Zealand. We have a group of advisors, Suzanne Blitchfield, John Ford from New Zealand, Jan Foster from USA with Linda, Alicia Meyer from Australia, who is also a mother with PWS, an adult daughter with PWS, Jackie, who most of you know from the UK, and Leopold Curves from the Netherlands. And then everything we do is also run by the board, the scientific board, as well as the board of directors of IPSWO. In 2012, we put up a survey asking families of adults with PWS a lot about their lives, about the life of their child with PWS and what they wanted. It was an 18-question survey. It was in 5 languages. It was in Spanish, English, German, Italian and Arabic. And unfortunately, in the very beginning, we didn't ask for height and weight. We were not going to be intrusive, and then I thought, no, this is a perfect opportunity to get weight and height from a lot of people, so we added it. We looked at their age, the family status, out-of-home participation, PWS traits that they saw in their adult child, what were most stressful, why, which were most difficult to manage and why, also the impact on their siblings, successful strategies that they used, and we asked how could FamCare assist them. We had 138 returned surveys. I've had a few more since, but we still only have 127 that are applicable because they are covering adults. We had several come in from children. The mean age was nearly 28, half and half, male and female. 73.2% lived with both parents, 85% had siblings, and of that 85%, 60.5% lived at home with the person with PWS and their parents. 52% worked, 38% attended a day program, nearly 60% attended a community recreational activities, and 68.5% participated in physical activity, which I thought was not too bad. Then we looked at the traits. What traits did you see in your adult child with PWS? We put up the list and they ticked whether they saw those traits or not. Now, it was interesting because, yes, food seeking and overeating, but more importantly, we saw lots of arguments, temper tantrums, perseveration, and slowness, and skin picking. They were the most common traits that were seen in the people we surveyed. The most stressful traits included, and this is gauged upon how they rated them, were food-related, anger, arguments, temper tantrums, an inability to cope with change, skin picking, and perseveration. And why were they the most stressful traits? Because there was constant stress to the family. They felt like they were walking on eggshells all the time to avoid behaviour. In an effort to maintain supervision of food, they were always thinking ahead, planning. The effort it took to maintain routine to try and prevent change. And the time taken, this really interested me that this was such a highly rated one. The time it took to go anywhere, especially if they had other children. It was so slow getting moving, and it was a problem for them. The most difficult traits to manage were food seeking and overeating, obviously, anger, temper tantrums, skin picking, and the inability to cope with change. Why? Because of constant complaining about food, the lack of medication for behaviour that these families were accessible to, living with constant food life restrictions and the impact that had on the other members of their family, the need for constant attention and supervision, especially when the parents were working, and the constant stress and this feeling of walking on eggshells at home. The impact on the siblings was very interesting. Yes, the siblings had a lack of attention, there was increased responsibility at a much earlier age, increased caring and understanding that they saw in their siblings, which was lovely, reduced interaction with others and rejection, and they didn't want to bring their friends home, and many moved away from the home early and a long distance from the home. So it ranged from being frustrated and negatively affected to being very involved and loving people as a result of having a sibling with Prader-Willi syndrome. Successful strategies that were used. The first one says none, which I shaded because I thought that was very sad. Threatening or punishing their child with food, trying to train them to feel full, that was used a little bit, preparing them for change, locking food, routine, Positive behaviour management, which was good. Talking and reasoning with them. Firmness, not arguing at all. Special people. Ignoring the behaviour, let's talk later. And the most common successful strategy, they're going in order of success, the most common successful one was remaining patient and calm. And I think that's brilliant coming from parents. So the family's desires were residential services. This was across the board. I think nearly everybody mentioned they wanted residential services. Professional information and advice, and complaining about the lack of knowledgeable professionals in their area. Education from other parents, wanting to get together with other parents. The availability of PWS-specific professionals. Job or activity centres that were appropriate for their adult child. Respite centres, some countries have none. Support for the families, so the families could get away, go on holidays, and improves societal and government awareness of PWS. This was quite a strong one. And then some people said they just don't know what they want from FamCare. So as a result of starting when we did, we have now just finished our 6th article. The first 5 are available on the IPSWO website, unfortunately only in English at the moment. So we started writing articles that we thought were pertinent to families as a result of what they answered in the surveys. So the first one was skin picking, coping with change, a healthy adult life, storytelling or confabulation, a health checklist which basically covers Suzanne's work. Most of it came from Suzanne, it's great, and managing a meltdown. That's our latest one, which is not on the website yet. It was only finished last week. So the future for FamCare is to promote correspondence. So we really want to hear from families. We have a couple of websites that I'll put up. Parent to parent, most of the members of our FamCare committee are parents. We want local PWS training for parents. This is ideally what I'd love to see, set up in conferences certainly, but training days. Local PWS training for professionals is extremely important and I think lacking in most countries. To encourage regional parent and professional meetings for the PPCB and FamCare to work together, and this has already started, and future articles. So our FamCare contact details are 2 email addresses, and you can go to the FamCare survey if you would like to complete that. We're still taking survey information through the IPSWO website. Thank you very much.